Hi and welcome back to my channel. My name is Dr. Meghan. I am a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this channel is a place for evidence-based answers to your weight questions. I've helped hundreds of patients lose weight and I'm here to help you too. Today we're going to talk all about Phentermine because I know you have lots of questions and I have lots to tell you. Phentermine, what is it? It is a stimulant medication. It's actually been around since the 1950s and it can be a really great tool for the right person. So how does it work? Phentermine really works primarily as an appetite suppressant. It doesn't really work on the stomach. It really works just in the brain to suppress appetite. And it is a stimulant medication, so there are benefits and risks with that as well. So how well does it work? People on Phentermine usually lose about 5% of their total body weight. Does it take a long time to go up on the medication? No. Usually I will start people on 15 milligrams of Phentermine, and then the max dose is 37.5 milligrams. So it's pretty easy to go up on, and you can increase that after about a week or 2 weeks depending on the patient. And it's an oral medication, so it's a lot easier for people to take, especially if they don't like needles. So the big question is Phentermine available as a generic? And interestingly, the FDA approval for Phentermine is a little bizarre. It was approved decades and decades ago, but it was only approved for up to 12 weeks of use. And that's actually not current accepted practice. Current practice is to prescribe Phentermine like we would for any other weight medication, and that is for lifelong use. And so for some patients, sometimes their insurance doesn't actually cover it beyond that initial 12 weeks of use for this kind of arcane reason. But the good news is that it is available as a generic. And so even if you do have to pay out of pocket, it's not astronomically expensive. Another really important question is who should not take Phentermine? So it's a little bit of a long list. So if you have any significant heart issue, if you had a history of a heart attack, if you have heart valve issues, if you have an arrhythmia, meaning like a rhythm issue with your heart, if you have uncontrolled blood pressure. Controlled blood pressure is usually okay. It's, talk to your doctor, but usually if everything is controlled with the blood pressure, it should be fine. But if it's uncontrolled, definitely not. History of stroke, history of pulmonary hypertension, if you have any real significant kidney impairment, if you have hyperthyroidism, any sort of uncontrolled anxiety or agitation could make it worse because it is a stimulant medication. Anybody with a history of substance abuse, you want to be careful. It is a relative of amphetamines. Also, it could show up as a false positive on a drug screen. If you have a history of glaucoma, it's not a good fit. And of course, if you're pregnant, thinking about becoming pregnant or breastfeeding. Side effects may include palpitations. This is going to make it sound great. Palpitations, high blood pressure, anxiety, constipation, dry mouth, insomnia, and several medication interactions. So it's always really good to talk to your physician about medications that you're currently on or things that you might be on in the near future. Make sure there's no significant interactions. Overall, though, I would say this is a really good medication, even though you're not getting, the effects of, say, a tirzepatide. You are getting some really solid weight loss. People can really have an improvement in their A1C, their diabetes measurement, and their blood pressure with even 5% weight loss. So don't discount it. I also think it's really helpful for patients who, let's say they are already on a GLP-1 agonist or a GLP-1 GIP agonist, and they're not quite where they want to be BMI-wise. Let's say they are started out at 37, now they're at 32. You could get closer to your intended goal that you and your physician have if you add something like a Phentermine. So it usually plays well with a lot of other medications, which is really nice. While it's not the first thing I will start with, it is often something I'll keep in mind as something to add on later if we're not getting quite to the therapeutic effect that we were expecting. Again, it's also really nice that it's a generic. So, I mean, there are shortages of everything right now, but when things are generic, it is just a little bit easier to find them. So that's really nice. Also, it's an oral medication. So that's a big bonus for a lot of people. Also, it is not to be confused with Fen-Phen, which was a weight medication that was taken off the market in the 90s. It was part of that. That was Phentermine and Fenfluramine. But that caused pretty devastating effects to people's heart valves, and for that reason, there is a black box warning for fenfluramine. There's pretty restricted use with that. And Phentermine was a part of that medication. So obviously that medication, Fen-Phen, is no longer in effect, but we can get very safe results with Phentermine on its own for the right patient. Let me know if you have more questions about Phentermine. I think it's a great tool for the right patient. So let me know if you have questions. I hope this was helpful. As always, my references will be listed down below. Like and subscribe if you want. And please be well.